Cancer touches so many lives. It's likely you know or love someone who's been diagnosed.
Yeah, the American Cancer Society estimates more than 1.9 million people will be diagnosed with cancer this year. But not all cancer patients are treated equally. Our team of investigators now digging into why diagnosing and treating reproductive cancers in non-binary and transgender people can be so difficult.
Investigator Zach Dahlheimer talked with survivors and doctors about what can be done to make sure everyone has a fighting chance.
You know, I didn't expect that I would be living a life with metastatic ovarian cancer, navigating gender identity challenges, and also educating people about it.
Dana Kivel has been on two journeys, one involving their fight with cancer that started in 2011.
And it was a rare form of ovarian cancer called granulosa cell tumor.
The other, finding their identity.
As I got older, I just started to feel like, well, maybe I'm actually feel a little bit less aligned with this sex, this body that I was born with.
At times, their journeys crossed paths.
In 2015, I was slated to get a bilateral double mastectomy, and that was also around the time that my cancer came back. So I had to put that on hold, and that was really hard because I'd been so looking forward to the surgery for so many years.
After eventually getting the surgery, they were then told by a doctor they had to hold off on taking testosterone because their cancer was hormone-based.
To them, it was just like, yeah, here's the science, here's the facts. But I think they didn't really quite get that what they were saying was, you can't do what you want to do that will help you become the person you want to become. And that was pretty devastating.
The National LGBT Cancer Network is shedding light on issues for transgender and non-binary patients.
Every time we have to go to a new doctor, there's a lot of dread and avoidance as far as how we're going to be treated.
The American Cancer Society says many LGBTQ patients experience discrimination based on sexuality or gender identities, even in medical settings. According to the Fenway Institute, 25% of transgender people report being harassed in a doctor's office. 19% report being denied medical care.
How prevalent would you say reproductive cancers are within the transgender and non-binary communities?
It's a great question, one I would love to have an answer for you with, but we do not have any answers related to that.
Dr. John Plemons is the medical director at the Centera McCleskey Comprehensive Breast Center at the Brock Cancer Center in Norfolk.
Certainly the number of patients that we see, that we know of, that identify either trans woman or trans man, isn't that great. And so it suggests that we still have some work to do in reaching out to that community, educating them about the need for screening, and helping them feel comfortable walking in the door.
In 2019, the center created guidelines for their doctors to better address trans patients.
They were seeing these patients in their office, and they didn't know what to tell them because they were getting good, reasonable questions, and there just wasn't a lot of information out there.
In addition, Kivel believes more attention needs to be paid to making everyone feel comfortable in the doctor's office because cancer can be a life or death issue.
There are trans women who get testicular cancer, and we need to talk about this. But if caretakers can't conceptualize beyond a narrow binary of how gender exists, well, only women get ovarian cancer, only men get testicular cancer, then a lot of people are going to feel left out. A lot of people are not going to be seen or treated, and a lot of people will die unnecessarily.
No matter how you identify, the best advice is to find a doctor you can connect with and ask questions about their experience for caring for patients like you. Now, the Cleveland Clinic has released guidance for transgender reproductive cancer patients. You can find a link to that information right now on this story at WTKR.com. Zach Dahlheimer, News 3.